When should you worry about pain during intercourse for cervical cancer? Pain during intercourse, also called dyspareunia, can sometimes be a sign of cervical cancer, but it's not always the case. If you notice pain that is new, persistent, or worsening, it's important to pay attention. Usually, early cervical cancer doesn't cause symptoms, which is why regular screening is so vital. But if the cancer grows or spreads, it can affect nearby tissues and cause discomfort during sex. You should be concerned and seek medical advice if you experience pain during sex that is different from what you normally feel. This includes pain that lasts over time or gets worse. Also, watch for other symptoms like unusual vaginal bleeding, especially after sex, between periods, or after menopause. Changes in vaginal discharge that are foul-smelling, thick, or discolored can also be signs of underlying issues. Persistent pelvic pain or lower back pain that doesn't go away is another reason to see a healthcare provider. Pain during intercourse can happen in early or advanced stages of cervical cancer, but it's important to remember that many other conditions can cause similar symptoms. Infections, cervical erosion, or hormonal changes can all lead to pain during sex. That's why any new or ongoing discomfort should be evaluated by a healthcare professional. Regular cervical screening through Pap smears and HPV testing plays a key role in catching cervical cancer early, often before symptoms appear. If symptoms like painful intercourse do show up, it might mean the disease has progressed, making early diagnosis even more critical. In summary, if you experience pain during sex that is persistent, worsening, or paired with abnormal bleeding, unusual discharge, or pelvic pain, it's essential to consult a healthcare provider promptly. They can perform the necessary tests to determine the cause and recommend appropriate treatment. Remember, every person's situation is unique, so personalized medical advice is always the best course of action.